Hello, welcome to a new model of non-communicable disease, that is Parkinson disease, a neurodegenerative disease. Myself, Professor Mitra Sen Majumdar, the Secretary of Parkinson Disease Patient Welfare Society, Kolkata. Though by profession I am a teacher of management and completely a non-medical person. Under this module, we are going to learn about Parkinson disease, a neurodegenerative disease, its genesis, how the support group Parkinson Disease Patient Welfare Society Kolkata came into existence, what are the workings of this organization, and what are the aims and motives or objectives of this organization, how it worked, and where we have failed to do our job of fulfillment of the objectives of the Parkinson Disease Patient Welfare Society, Kolkata. Parkinson disease affects the mobility of the person. It started with tremor, shaking, usually starting on one side. Gradually they develop rigidity, stiffness of the limbs, neck or trunk, and then akinesia. They developed drooling. The main symptoms of this disease are excessive sweating, then constipation, then the myelography, that is their handwriting becomes fragile gradually, then they cannot move easily or walk easily due to the difficulty in posture and balance. Their face become masked, they have stony stare, and after some time they develop dyskinesia, that is a one type of involuntary movement of the body. And the research is going on about why this disease happens and what are the remedies, what is the cure. It is not found till date. Most of the patients are the earning members of their family, and due to this disease they lost their job because they are not able to perform their day-to-day duties in a regular manner. Due to this disease, they cocoon themselves in their home, and this is why they isolated from the society. They avoid socializing and gathering. They need 24/7 hours support from the caregivers, and ultimate result is that the caregivers also exhausted with dealing with these type of patients. So patients and caregivers badly need a support system where they share all their agonies. This disease leads to loss of income of the family, then and definitely it results anxiety, depression. So there I can see that it has a multiple effect on the family. They need a very good support system apart from doctors and therapies, because doctors provide them the medicines, prescribe them the medicines and the therapies, but they need multidisciplinary therapy apart from the medicines. Every day they need 15 to 16 medicines, and this affair is very costly also. They need multidisciplinary therapies at their home. so that they can move, they can walk easily, and that cannot be possible for every family to afford the cost of the therapies and medicine. They need support system where they can express, share their feelings, their experience with the fellow patients, and they can visit that place without any hesitations, where they feel comfortable at home. They are acceptable in that place. Again, start enjoying life like anything, and the support group can provide them the multidisciplinary therapies at their centers at a very effective cost. So there is coordination, there must be coordination between the doctors, therapists, and the support groups. Only then the Parkinson patients and their family can survive easily, and they feel comfortable. They can come back to the normal life. They can lead a normal life like a normal people in the society. They can again acceptable to the society. My father died of cancer in 1993, and my younger and the only brother slipped into depression. We noticed some behavioral changes in him and consulted a psychiatrist. He was on medication, and we shifted to Kolkata from Patna. He tried hard to cope with the new environment, but his new colleagues never accepted him as a friend. By the time he had severe attack of tremor in 1994 in the office and detected Parkinson disease. People are not aware of the disease, and it leads to humiliation in public places, leading to depression. I had seen him passing through all the stages of Parkinson disease. At that time, he was just 40 years old, and this condition diagnosed as young onset Parkinson disease. I have started finding solution, and solution was only forming a social support system for PD patients and caregivers, where they can exchange their feelings to other fellow patients, and where we can provide the multidisciplinary therapies at a lower cost, and give them a platform where they can socialize with the other people. PD patients lose their motor skill over the time. It results in depression. All activities ceased due to disease. The constant fatigue leads to anxiety and depression. Mood swing leads to stubbornness and anger. Gradually, the PD affects their voice, their handwriting, and they avoid speak out in the public. The sole earning member of the family lose job due to the disease. It is really unacceptable to the patient and the family. There is a lack of awareness in the society, and finally, they isolated themselves from the society. The loneliness and depression aggravates the disease. They need empathy and support, which can be provided by the support group only. I have experienced the disease as my brother is suffering with PD. I feel they need a joyful environment to minimize the depression, which will improve their condition. I felt an urge to form a support system for the PD patients and their caregivers. And Parkinson Disease Patient Welfare Society came into existence in 2014 with the help of our president, Dr. Rishikesh Kumar, an eminent neurologist with specialization in movement disorder, because this disease needs a doctor who has a degree in neurology as well as specialization in movement disorder. PDP-WSK now running 2 centers in Kolkata, where all sorts of therapies are provided to the patients. We are having a group of caregivers with us who actually run this organization. We formed this NGO with the help of the neurologists, researchers, and other patients. I am managing the PDP-WSK as the secretary of the organization. We have formed a choir group for the patients and the caregivers. In spite of speech therapy, this music therapy helped them to strengthen their voice and speech. We raised funds through crowdfunding by participating in the marathon. Our Dr. Rishikesh Kumar, himself a very good marathon runner, and all patients and caregivers participate with him in the marathon every year. In our centers, we provide, apart from multidisciplinary therapy and the music therapy, movement dance therapy, Tai Chi, and all sorts of things which can enlighten the mood of our patients. We organize picnic every year. We celebrate the birthdays of our patients, and every year we celebrate the World Parkinson Day, where with a spectacular cultural program, and participants there are all our patients and caregivers. We booked an auditorium and we celebrate this function in a very elaborate way. And doctors are also participated with the patients. We have started spreading our wings to the other parts of West Bengal. Recently, before the pandemic, we have organized an awareness program in Asansol. Our choir group performed there. We do the dramatics and other activities in the public places so that people are aware of this disease. But due to this pandemic, now everything is under wrap. Let's see, the time will pass and we will. PDP-WSK has succeeded to enlist the Parkinson disease in the disability list of the central government. Then we have succeeded in getting membership of IAPG for policy advocacy and inclusion of PD as a non-communicable disease. We have successfully done the documentary on Parkinson disease, first time in India, in the name of Things Fall Apart, and published it on our YouTube.